on a piece of paper and see. So,
Johanna, I'm seeing 116, 86, 116,
okay,
all
sounds
of
good.
them.
All right,
Mhm.
thank you, Sharon. It takes a village here. All right, so, and the correct answer is actually yes, 116 million. So those of you who guessed that, that is the right answer. So, and so again, with diabetes, what do you think the numbers are proportionately for diabetes? So do you believe it's like 1 in 10 adults in the US, 1 in 15, or 1 in 25? And again, I'll give it a few seconds and have Sharon let me know in the chat.
I've seen a mix, 115, 1 in 25, 1 in 10.
Okay. So on that one, it's 1 in 10 adults, unfortunately. So this is a big problem. So we're here to kind of talk about it a little bit. And these are our objectives: to talk about these 2 common chronic conditions that can impact the quality and length of your life, and to also learn how to take proper blood pressure measurements, because you'll see in the presentation that that can be a really useful tool for you. And then to learn some small steps that you can make, that can make a big difference to prevent and improve these chronic conditions. So again, these chronic conditions that we're talking about today are hypertension and diabetes, and they're extremely common. In fact, when we look at what's happening in the state of Washington here, you can see the causes of death. But when we look at heart disease, which is the second largest cause of death, and then stroke, which is the 6th, combined, they're actually the #1 cause of death for Washingtonians. And that represents about 1/3 of all deaths for the year 2018. So this is important stuff. So again, hypertension. So hypertension, or high blood pressure, hypertension is actually a diagnosed condition. So we'll use those terms interchangeably, but hypertension means your doctor has told you that you have sort of chronic high blood pressure. But you could have high blood pressure for various reasons throughout the day, or it could be elevated, and that may not necessarily mean you have hypertension. But according to the Centers for Disease Control, the CDC, in 2019, hypertension was a primary contributing cause to more than 500,000 deaths in the US. And also nearly half of US deaths have, US adults have hypertension. And that would be a blood pressure reading pretty consistently of 130 or 80, over 80 or higher. And the thing is, only about 25% of those have it under control. So it's really important to find out what your numbers are. So again, hypertension is a diagnosed condition. If you have elevated high blood pressure here and there, it doesn't necessarily mean you have hypertension, but we will talk about why it's important to track your blood pressure a little bit later in the presentation. But here are some of the risk factors to look for. So if your blood pressure is consistently elevated, if you have diabetes, if you're eating too much sodium and too little potassium, if you're not getting enough physical activity, if you're obese, sometimes genetics can play a part. Tobacco use is certainly a factor. And then too much alcohol. And then when we talk about alcohol, we're talking about, for women, it's like 1 drink or less per day. And then for men, it would be about 2 drinks or less. So that kind of gives you an idea. And then looking at diabetes. We're also here to talk about that, and specifically type 2 diabetes, or what's commonly called adult onset diabetes. And here are some facts. It's having diabetes can put you at risk for blindness, for kidney failure, for heart disease and stroke, and for loss of limbs like toes, feet, or legs. So it's certainly nothing to mess around with. And we always like to talk about prediabetes too, because that's something that we're really recognizing as a huge risk factor. So if you're overweight or over 45, you might want to talk to your doctor about getting your blood sugar tested. Particularly if maybe you have, if it runs in your family, if someone in your family has had type 2 diabetes. And if you're physically active only 3 times a week or less. And Sharon will talk to you more about what optimal physical activity is. And it's not going crazy, but it is important to move your body to get the blood sugars to be utilized. And then also, if you've ever had gestational diabetes, which is diabetes during pregnancy, or if you've given birth to a baby that weighed more than 9 pounds, those things also put you at risk. And then, of course, there's if you have polycystic ovary syndrome, that can also put you at risk, which I find surprising. So, but here at the health department, in public health, we're always looking at other factors. And so these are less quantifiable risk factors, but they're also really important to look at, because when it comes to health, we like to look at the social, environmental, and economic conditions for health as well, such as living in unsafe neighborhoods and what we call food deserts, where there aren't enough grocery stores or places to buy fresh food. Are you, underinsured or uninsured, or just lacking an opportunity? All of these things can be barriers and stresses. And we know that stress also can affect the body, and it can certainly have an impact on chronic disease. So it's just really important to take all these things into account when looking at chronic diseases such as diabetes and conditions such as high blood pressure and hypertension. So yeah, it's just, we like to look at the root causes and for the entire population. And this is another root cause. So it's important to know that sometimes it's not just the lifestyle that we're living today that is the reason why we might be unhealthy. It may have started in childhood. There's something called adverse childhood experiences, or ACEs, and those are severe and repeated exposure to harmful experiences without the support of caring adults. And this can cause toxic stress responses in children, which puts them at risk of health, learning, and behavior problems across their lifespan. So some of the adverse childhood experiences reported by adults have been like physical, emotional, sexual abuse, just living in a dysfunctional family. And there's places that you can go to actually score, to take your ACE score. And it's really interesting. And then if you can kind of correlate that with your health and well-being today, that can really give you a lot of important information about yourself. So it's just good to know that it isn't always our fault, So back to blood pressure here for a moment. What is blood pressure? So blood pressure is the force of your blood pushing against the walls of your arteries. And blood pressure normally rises and falls throughout the day. And problems develop when your blood pressure remains elevated and is poorly controlled. And then here's a little bit of a little bit more of a technical slide, but it just kind of gives you an idea of what the numbers actually mean. So the measurement that we do, the measurement for blood pressure is in millimeters of mercury. That's what that MM stands for. And that's just measuring how much fluid is displaced in the measuring device. But even we don't use mercury to measure blood pressure anymore, but that's still what the measurement is called. And so the thing I want to kind of impart to you is that there's a top number and a bottom number generally in a blood pressure reading, or a first number and a second number. And so that first top number is called the systolic blood pressure. And that's the amount of pressure inside the blood vessel when the heart squeezes. So that's the pumping blood through the arteries to the body pressure. And then you've got that bottom number, the diastolic, and that's the amount of pressure inside the blood vessel when the heart's relaxing, so between pumps. And so it's for preventing like heart attacks and strokes and damage. You really want to be in the 120/80 range. So you don't want to really go over that too much, because surprisingly, when you're going over that amount, there's already kind of damage happening to the blood vessels because of the pumping action. It's just, there's too much pressure there and it kind of wears and tears. So yeah, so anything over 120/80 is really considered elevated. And so then Sharon will actually go through some more of that table with you a little bit later. But it's really important to know sort of where your blood pressure is, because it's going to vary, right? It's going to not always be the same, depending on if you've been moving around or if you're particularly anxious, or, some people have like even white coat syndrome when they go to the doctor, which is they just get really tense when they go to the doctor and their blood pressure goes up. So anyway, I'll just go on here. And again, what is diabetes? So diabetes is, there's a type 1 diabetes and a type 2. And type 1 often occurs in childhood and is often called like juvenile diabetes. And it's actually thought to be an autoimmune disease, right? And so the body, for some reason, stops making insulin. And it's interesting to note that actually seems to be on the rise these days. The numbers of children coming down with type 1 diabetes is on the rise, but it's still, type 1 cases are just a fraction of overall diabetes. The majority of diabetes is really that type 2, that adult onset lifestyle diabetes, where your body is just not using insulin well anymore, and you can't keep your blood sugars at normal levels. So you need to have take some action there. And again, back to pre-diabetes, where your blood sugar levels are higher than normal, but they're just not high enough to be diagnosed as type 2 diabetes. And approximately 96 million adults have pre-diabetes, which is more than 1 in 3, and 80% don't know they have it. So there's a good chance, that you or someone as I stated in the beginning, may have diabetes or pre-diabetes, because we just don't always check for it, right? And so hopefully now, knowing these risk factors, you might just want to talk to your doctor to see if your blood sugar levels are in the right range. And speaking of which, there's a test called the hemoglobin A1C, and that test measures your average blood sugar levels over the past 3 months. So definitely, when you go to the doctor, if you're over the age of 45 and you don't know your A1C, you might want to just have them take a baseline. And so if it comes back, 6.5 or above, then they'll probably have to work with you as being, having diabetes. And if it's between 5.7 and 6.4%, that's in that pre-diabetic range. And there's still a lot you can do in that range to prevent diabetes, right? And so that's also something that we can mention. But there are diabetes prevention programs, and we can give you some information on those. And then if you're below 5.7, yay, hallelujah, you're doing good. And so the diabetes prevention program is where you can lower your risk of developing type 2 diabetes by losing just 5 to 7% of your body weight. So if you calculate that, that may not be that much, and just increasing your physical activity. And usually this happens in kind of a group setting, so everyone's supporting each other. It's really a great program. And so it's a lifestyle change program. The coaches are trained, and you can learn to eat healthier, specifically for lowering your blood sugar as well, and also incorporating more movement, which is so key. And then there's tips to manage stress and succeed on your health journey. And so you can lower your risk of developing type 2 diabetes by almost 60%. So that's kind of cool. And then just a brief mention on oral health, because oral health, your head is part of your body. And so oral health really does affect overall health in so many ways, and well-being, right? If you've got a toothache, or your teeth are you're not confident about your smile, or there's just problems going on there, it can affect your career even, or your ability to learn. So oral health is essential to general health and well-being. It can cause pain. Oral disease can cause pain and infection that can lead to problems eating, speaking, or learning. And cavities and severe gum disease or tooth loss can affect your overall health and quality of life. And interestingly, there's another correlation between smoking. So getting rid of, stopping smoking is always a good thing, because it's also good for your mouth and your teeth. So I will have my colleague Sharon tell you kind of what you can do about all these problems that I've presented. So Sharon, if you're ready, you can take it from here.
Thank you, Johanna. Yeah, so I'll be talking more about what we can do to be more active, also eating well. Johanna mentioned checking your blood pressure. I'll be discussing a little bit more about what to do if you're checking your blood pressure at home or when you're going to the doctor's office. And it's important to understand your blood sugar levels. That way you can take control of your own health, as well as knowing your cholesterol levels, and steering clear of smoking or vaping, and following your doctor's recommendations. So having a conversation with your doctor about what your goals are and how you can get there. Next slide, please. So before you measure your blood pressure, you want to make sure that you haven't had any coffee for at least 30 minutes before you measure. You'll also want to make sure that you haven't smoked or used maybe a vape pen for at least 30 minutes before your measurement. Also, don't exercise or eat a large meal 2 hours before your measurement. Sometimes we might not take this into consideration. So people may have a big breakfast and then go to the doctor's office, and that can definitely affect our blood pressure readings. Another thing that people sometimes don't know is that it's important to empty your bladder before checking your blood pressure, because a full bladder can also affect your blood pressure reading. And you want to make sure when you are checking that your arm isn't above your heart. You want to make sure that it is, that you don't have any tight fitting clothing, that it's positioned correctly, that your feet are flat on the ground and that your back is supported. Next slide, please. So here is the simple steps that you can take when you're going to measure your blood pressure. So sit quietly in a chair 5 minutes before you measure, supporting your back and placing your feet flat on the ground. Do not cross your legs. Remove any tight-fitting clothing from your upper arm and position the blood pressure cuff about 1/2 inch above your elbow with the arrow over your brachial artery. Next slide, please. All right, and as Johanna mentioned earlier, there are different things that you can do depending on where your blood pressure readings have been. So for example, if you go to the doctor's office or if you're checking at home and you've seen that they've been normal, you can continue to do what you've been doing. Maybe you're being really active, eating lots of fruits and vegetables, and that's why we're seeing those numbers. Or maybe you're also taking your blood pressure medication. That's why everything's looking good. If it's in the elevated category, it's important to take into consideration lifestyle modifications. You can talk to your provider, see what they recommend. And then when it's in the high blood pressure category, following up with your doctor, they may want to see you more often to see how your blood pressure medications are doing, to see how you're doing, what steps you're taking, and same when it's elevated at the stage 2. And just making sure that you're going to your doctor's office when they want you to come in. And if you see that it's ever 180 over 120, it's important to call 911. And sometimes we don't even know that our blood pressure is elevated. That's why they call it the silent killer, because we don't even feel it. So we may be feeling fine, but our blood pressure could still be high. Next slide, please. And there are many resources that we can all look into. There is the American Heart Association, the Washington State Department of Health, to learn more about blood pressure initiatives as well, like what's going on in the state, what's going on in our community, what we can do in our community, what we can do with our families to maybe be more active as well. Next slide, please. And there's a program called Check, Change, Control. This program was created by the American Heart Association, and it works with clients that have elevated blood pressures. They work with a community health worker or a health minister that is in their community, and the health minister will follow up with the client for 4 months to see how their blood pressure readings have been doing. The clients have to check a few times a month and follow up with their community health worker, and they can also follow up with their doctor. Next slide, please. As I mentioned, it's for 4 months, and they also receive information on what to do to bring down those blood pressure numbers. So for example, there's emails that can be sent to clients if it's virtual that talks about how to reduce sodium and also what to do when we are stressed or when we're just having a bad day, what to do to relax and help our mental health. They also talk about food, what we can do in order to increase our fruit and vegetable intake, increasing our water intake as well, maybe reducing our soda intake or our juice intake. Next slide, please. Okay, and nutrition. So a healthy eating routine is important at every stage of life and can have positive effects that add up over time. So there's a MyPlate method, and it has different categories. So it's important when we're eating to try to target each category and have a food that is in like the protein group, in the green group, in the vegetable group, in the fruit group, in the dairy group, and what is in the protein group. So the items that are in the protein group are things like chicken, there's also fish, there is meat, and there is salmon, just fish and tuna. And there's also beans, legumes that are in the protein category as well. And what is in the grains group? So in the grains group, there is rice, there's oats, there's cornmeal, barley, there's bread and pasta. And then vegetables, what is in the vegetable group? There are tomatoes, there's spinach, there's broccoli, there's carrots. There's a whole range of vegetables that are out there. And in the fruit group, there's a lot of fruits as well. There's mangoes, there's strawberries, cherries. So whatever you enjoy eating, you could even try maybe a new fruit. It's springtime already. There's things that are coming back in season. Also, like maybe if you like watermelon or different items that you enjoy, trying to get those in your everyday life. And then the dairy group, which includes milk, yogurt, cheese, and it does not include things such as cream cheese, sour cream, or butter because it is very high in fat. Next slide, please. All right, so when eating fruits and vegetables, we want to try to eat them the way nature provided, or if we are going to use some techniques, maybe using fat-free or low-fat cooking techniques. We can also have frozen or canned fruits and vegetables. Sometimes people enjoy having frozen grapes or frozen blueberries. They're easy to take on the go. We also want to choose whole fruits over fruit juices or drinks, because when we eat, like let's say an apple, when we're chewing that apple, it has fiber. And if we're just drinking like apple juice, we're not getting the fiber that our bodies need. Next slide, please. And diets. I know a lot of us have heard about a lot of these diets. They're very popular. We've seen them everywhere. We've probably had a friend that has done a diet, or maybe ourselves have tried to do a diet before, but there's only a few diets that are recommended by the American Heart Association. The first one being the Mediterranean style diet, which emphasizes vegetables, fruits, whole grains, beans, and legumes. The second one would be the dietary approaches to stop hypertension, which is called the DASH diet, which has low fat or fat-free dairy products, fish, poultry, non-tropical vegetable oils, and nuts. And the ones that the American Heart Association does not recommend are paleo, keto, Atkins, interval, zone, and Whole30. So these aren't recommended because they do not meet the American Heart Association's science-based criteria for a healthy eating pattern. They may show dramatic results in a short period of time, but they are not heart healthy. Next slide, please. And physical activity. This is something we have been hearing for a very long time. Sometimes people call it exercise, but we can call it physical activity because we want to move our bodies. It doesn't necessarily have to be like running or anything intense. And there are many benefits that come to being active. So it lowers health risks and complications, better sleep, improved cognition, less weight gain, better bone health and balance, fewer symptoms of depression and anxiety, better quality of life. And adults gain most of these health benefits when they do moderate to intense aerobic physical activity. It's recommended to do at least 150 minutes per week, which can be 2.5 hours. You can definitely increase it if you want, and you can start slow. If you're not being active at all, you can definitely start with like 10 or 15 minutes, and then you can reach your 2.5 hours. And it's also recommended to do muscle strengthening activities of moderate or greater intensity that involve all major muscle groups. So that can be using weights, it could be using your own body, maybe doing push-ups or whatever your body can do, but using all of the muscles in our body. Next slide, please. And what is aerobic exercise? So aerobic exercise is an activity that gets your heart rate up. It improves cardiorespiratory fitness. That's good for your heart. Moderate intensity aerobic activities include brisk walking, water aerobics, dancing, gardening, tennis, and biking. So it's a great time to start gardening. And you could also get vegetables and fruits if you're gardening. So you're getting everything at once. You're getting your physical activity and you are also getting in fruits and vegetables. Or flowers, if you like to garden flowers. Next slide, please. Okay, what is anaerobic exercise? Anaerobic exercise is intense and you can only perform it for a short time. Anaerobic exercise includes aerobic components. This is especially true of sports that combine less vigorous activity with sprints, like basketball and tennis. So aerobic would be probably like running a mile, and then anaerobic would be sprinting, maybe 50 yards or whatever you're able to sprint. Thank you. What kind of physical activity do you enjoy or would like to try? So think about that. Would you enjoy walking? Do you like being outside or do you prefer being inside? Maybe if you like to be inside, do you want to maybe try a dance class? You could do volleyball. There's inside volleyball and there's outside volleyball as well. And it's beautiful outside today where I'm at, but maybe where you're at, it's also beautiful. So maybe taking a walk later on today, whatever you enjoy doing. Next slide, please. Mental health. And mental health is very important. It's natural to feel stress, anxiety, grief, and worry, but it's important to learn to cope with stress in a healthy way that will make you and the people you care about and those around you become more resilient. It's important to unwind. A lot of times we become stressed because of our work, of what's going on in our lives, what's going on in the community or in the world. So it's important to take time for yourself. If you enjoy drinking tea and that helps you unwind, then you can drink tea or drink water with lemon, whatever helps you. It's also important to connect with others. So if you have a support system, it could be friends, it could be family members, whoever you like to speak to, it's important to reconnect with them. Sometimes we haven't talked to them in a long time, and that's really helpful for our mental health and well-being. Also, identifying and accepting things over which we don't have control. And as I mentioned earlier, exercise, physical activity, spending time outdoors. There's been studies that have showed that spending time outdoors in the wild, like in the forest or somewhere where we can relax and spend quality time with ourselves or others can definitely help our mental health. Next slide, please. And quitting smoking. So people who smoke have a greater risk for diabetes, for diseases that affect the heart and blood vessels, so cardiovascular disease. And smoking damages our blood vessels and it can make them thicken and grow narrower. This makes the heart beat faster and it makes our blood pressure increase. Smoking can also cause stroke, coronary heart disease, which are among the leading causes of death in the US. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Next slide, please. And setting goals. So if you want to eat healthier, if you want to increase your physical activity, if you want to maybe quit smoking, it's important to create SMART goals. So SMART goals stand for specific, measurable, attainable, and realistic. And these are some examples of how to create goals that will fit into this category. So instead of saying, I want to eat healthier, we can say, okay, I want to eat healthier, but I will do this by increasing my vegetable intake. So instead of eating like 1 vegetable per day, I will increase it to 5 or however many you want to increase it to. And I will also eliminate soda. And then measurable, instead of saying I want to walk more, we want to be a little bit more specific. So we can say I want to walk 10 minutes for 5 days each week. And attainable, instead of saying I want to lose 10 pounds every week, we can say I want to lose about 1 to 2 pounds per week. Realistic, eliminating all sugar. We can try to say, if we are going to choose options, trying to choose options that say no sugar added. And then time bound, instead of saying, I just want to lose weight, we can have a goal weight by a certain date. Next slide, please. Okay, and there are various programs for whatever your needs are. So if you don't know, but maybe want to know about how your blood sugar readings are, then you can go to the doctors. They can do tests on you to see how your blood sugars are doing and how your cholesterol levels are. And then once you get those numbers, you can see if you're in the pre-diabetes range, you can participate in the diabetes prevention program. It's a very good program that helps clients become more active, lose weight, and eat healthier. And as I mentioned earlier, the self-measured blood pressure program, Check Change Control. It's for clients that have elevated blood pressure, and you can check your blood pressure readings at home. You can track them. And it's important to see how you're doing with your blood pressure at home, not just at the doctor's, because sometimes we'll go to the doctor's maybe once a year, and that doesn't really give us a good reading of what our blood pressures have been like for the whole year. There's also Enhanced Fitness. This is from the YMCA. It's for older adults, particularly those with arthritis, and they can benefit from this because it incorporates simple and easy to learn movements that inspire everyone to stay active. There's also Moving for Better Balance, which improves your balance and prevent falls. It's like a modified take on Tai Chi, and it's a 12-week program that was developed by researchers at the Oregon Research Institute. Next slide, please. And we want to acknowledge the Washington State Department of Health and the Check Change Control Program. A lot of the information that we got was from Cheryl Farmer, Marissa Floyd, Sarah Eve, and Alexandra. Next slide, please. And the resources, if you are in crisis, you can get immediate help by calling 911. There's also the different programs that we discussed, like the blood pressure program, active adults. There's also freedom from smoking. If you want to quit smoking, this is a great program to understand the reasons why you're smoking and what to do if you feel like smoking. Next slide, please. And these are the references that we used today. So this is where we got all of our information that has to do with blood pressure, blood sugar levels, being active, and eating healthy. And any questions or comments? This is our information. It's Johanna's information, her email address, phone number, and my information as well. And you can feel free to reach out to us if you have any more questions or would like more information on programs that are happening in the community.
Johanna and Sharon, thank you so much for the information you shared today. And I just kind of want to reiterate going back to the health screening portion of it. I think a good place to start, whether it's with yourself or whether it's promotion to your employees, is a health screening. What's the starting point? So yeah, you can try all these different things, but what if you have high blood pressure? What if you, you hit the gym hard, but you're not being kind to your heart? So promoting those health screenings, getting your blood pressure checked, getting your high cholesterol levels checked, your blood glucose, your HDLs, all very important to do to promote. Our bodies change with every year. There's some doctors out there who promote their patients seeing them every 2 years to get a health screening. I disagree. I disagree with that because we change so much. So yeah, very great information. Thank you so much for your participation in our meeting today, Johanna and Sharon. And looks like we've got some extra time here. We've got about 15 minutes before our next presentation. So let's see, why don't we go ahead and leave this meeting and let's jump into the next one so we can make sure that everyone meets us there. Thanks, everyone.